Thank you very much for the invitation to participate to this very important discussion. It's a pleasure to be here in the middle of the night. I'm sorry that this was not the occasion to visit Japan, but I hope to have another occasion very soon. What I want to talk about is how to do disaster risk management in the current context of the COVID-19 crisis and recovery. And I will touch on three different issues. One is the similarities and the differences between the COVID-19 crisis and I would say more traditional disasters that we're more used to. Then I will talk about those compound shocks in the sense that the current situation doesn't mean that other disasters cannot happen. So we have to think about how different we should react now if something would occur during this very special period. And finally, I'll discuss about the recovery out of COVID-19 and how we can make that recovery an opportunity to build back better in a way that is more resilient, but also more sustainable and also more efficient toward a more prosperous future. So if you put the next slide, I'll just move to my first point, which is to discuss the similarities and differences between COVID-19 and other disasters. And the first thing showed in the next slide is the first is a similarity. So if you show the next slide, all disasters, if you look at the impact not on a country or a city, but if you look at the impact on people, we find that poor people lose very little in value. So if you count those impacts in US dollars, you'll find very small amounts. But if you're looking at the impact on their well-being, their quality of life, their long-term prospects, poor people tend to suffer much more than the average. Here you see a map of the Philippines showing where the risk is located when you're using a monetary metric. So the value of the damages in, say, US dollars or Filipino pesos. And of course, you see Manila in that map because that's where a lot of the high value assets are located. So if you look at risk in the monetary value, you see where wealth is located. What you see on the left is the distribution of losses per person for 5 quintile, from the poorest on the left to the richest on the right. And what you see is if you look at asset losses, so the monetary losses, well, rich people are losing more, and that's because they have more to lose in the first place. But if you take into account the situation of poor people, and especially the fact that they have less to start with, a big part of their consumption is consumption of essential goods and services like food, health, education. If you take into account that they don't have access to the same tools and instruments, they don't have insurance, they don't have saving accounts, they don't have access to borrowing, to repair. If you take all of that into account, then you find that poor people are much more affected. And if now we think about COVID-19, we have the same thing. We might look at the losses in GDP, losses expressed in US dollars or other monetary metrics. Those impacts do not show us what it does to poor people. And if we care about the well-being of the population more than anything else, then we really have to complement those metrics in US dollars with different metrics that makes it possible to see what happens to poor people. If you go to the next slide, there is another thing which is similar between the disasters we are dealing with, earthquakes, hurricanes, floods, and COVID-19. It's the role of supply chains and trade. So I show a picture of the Bay Bridge in San Francisco because that's one of the best examples I have of how a critical piece of infrastructure can be damaged even just a little bit. And maybe the damage in terms of reconstruction cost is not that high. But because the Bay Bridge is a critical connector in the Bay Area, the impact on the economy can be absolutely massive. And if you look only at the direct effect, you would completely miss what this damage to this bridge might be doing to, I don't know, a small restaurant in one side of that bridge. For COVID-19, we have a little bit of the same issue. Initially, people were focusing on the occupations and jobs that were the most directly affected because they cannot be done while distancing. Now, with the time of this crisis, we see that some jobs are being affected by secondary effect through supply chains. So I did not know how to illustrate that for COVID-19. So this is a picture of an accountant. An accountant is perfectly able to work remotely. But still, if you look at data in the US, you see that this is one domain where people have been losing their job and income, not directly, but indirectly. And those two very important points, the distributional impacts and the fact that poor people tend to be more affected, but also the fact that losses are distributed very heterogeneously and are propagated through a very complex network of relationship, is really important when we speak to the people in charge of the situation right now. Because our community working on disasters have a lot of experience assessing the losses, thinking about who is affected and how to target support to the people affected. If you're talking about the people used to manage economic crisis, the type of impacts that they are used to are very different. So I think there is a value in our community stepping in and bringing the experience of targeting support to affected people after disasters, because this is really what we need in this COVID-19 context. If you go to the next slide, there is one big difference between COVID-19 and a lot of the disasters that we're used to talk about. For earthquake or a cyclone, the impact has two legs. One is, this is a factory being destroyed by a hurricane. This factory cannot produce. So there is an impact on economic activity, which shows in GDP. And there is a second leg, which is the impact on consumption, because not only this factory cannot produce, but somebody needs to pay to rebuild it. And for most disasters, the impact through this consumption channel is very significant. And if you move to the next slide, it means that the faster you can rebuild, the lower the losses. So on the left, you see a little figure illustrating that. It's how much losses are increased when the reconstruction duration increases. So for a 10-year reconstruction duration, for instance, we estimate that the total losses are about twice the losses for the same amount of damages if you can rebuild in about a year. And this means that accelerating the reconstruction is an absolutely critical aspect. And of course, everybody in this conference will know a lot about that. We estimated that with just a better reconstruction process, we could reduce the total impact of disasters by about 1/3 in the world, not changing the direct damages, just by rebuilding better. And this has been a big focus of our work. If you go to the next slide, for COVID, things are very different because you don't have like one shock and a reconstruction. Instead, you have this back and forth between lockdown, not lockdown, restrictions, more relaxed periods, and so on. And so here, I think the good analogy is with drought. And for two reasons. First, because of these slow onset characteristics where things can get worse and then better and then worse again. But also because in a drought, economic impacts are through the lack of water, but also through the restrictions that we impose to preserve water. And so a part of the damages comes from the policies we implement. And it means that we can learn from what we have done for drought. I'm thinking about tools like the US Drought Monitor, which is a set of criteria on the situation of the drought in the country, linking to some of the measures that can be implemented in a way that is predictable and that everybody knows. So it allows planning by private actors. And this is, I think, the right direction. I think in the other direction, we're working on disasters like earthquakes, flood, and droughts have to learn from the COVID experience in terms of the communication to the population and this ability to just adjust measures to the situation. So if you go to the next slide, just to conclude on this first part, the point I wanted to make here mostly is that in Ministries of Finance and Ministry of Economy at the moment, a lot of people are managing the COVID crisis like an economic crisis. I think knowledge from how to manage a disaster is relevant here because this is not your normal economic crisis, and especially impacts are distributed very differently, and we need to take that into account in how we help people. My second point of discussion will be about the vulnerability today to other disasters due to the COVID-19 situation. And here, like a lot of the work we've been doing in the last years, we want to think at the household level. So vulnerability being thought of for a family as the unit of analysis, not so much the city or not so much the country. If you go to the next slide, this is a very simple depiction of the tools that people use when they are affected by a disaster. And there are many tools. There is not one thing. And people use different tools depending on whether they are affected by small shocks, like a little flood in a village, or like very, very intense disasters, like a major earthquake. You don't use the same tools in those two situations. And similarly, poor people will not use the same tools than rich people. So what we have is this puzzle of different instruments with like revenue diversification for small shocks, and then you use your savings, you go borrow, or you use market insurance, but that's mostly for rich people. Poor people tend to rely quite a lot on adaptive social protection systems. The important point here is that all of those tools, all of them have been affected by COVID-19. And the ability of governments to help has been reduced because a lot has been spent. So if something else happened now, the resources will be more difficult to mobilize. Even insurers have been affected by COVID-19. But the point I wanted to make mostly, and it's illustrated in the next slide, is the role of people saving. So this figure is a little bit complicated, but I think it's really telling. This is for the Philippines again. And on the x-axis, you have people at different income levels. And the green bars are the amount of savings those people have in a household survey made before COVID. And the dark line, the first one at the bottom, is the income they make in 1 month. The other lines are for 2 months and 3 months. And what you can see is all the people below $300 per month in the country, more or less, they have less than 1 month of income in savings, which means that if they lose income for 1 month and they want to keep consumption as it is, they will have no savings. So we're talking about 50 million people in the country with no precautionary savings after 1 month. After a year of COVID-19, it means that precautionary savings in the world today, we don't have hard data, but have probably been used and more than used, which means that this buffer that all of the families tend to have, and which is so important because that's what is there immediately. You don't need public action. You don't need an insurance claim to be paid. This buffer has probably disappeared for many, many people. So if something bad happens now, like happened in Indonesia, unfortunately, a few weeks ago, the needs for intervention from the government perspective is probably much, much higher because those buffers that people have has been used already. So again, I think this is role of this community to make that very clear, because if something happens, reaction needs to be very urgent. Next slide, I move to the last part of my presentation, which is a discussion about what we can do in the post-COVID recovery. And here I say post-COVID, COVID will stay a little longer with us, it seems. But as the emergency, the health emergency is getting more and more under control. The question will be to fix the damages made to our societies and economies. Next slide. It has to be done with a huge increase in poverty and a huge increase in debt. So not an easy place to be. Next slide. What we want to say first is a lot of countries have built up their social protection system to respond to COVID. A lot of new systems have been created in urgency. When the crisis is over, we should not let those systems go away. I'm not saying that we should continue handing money to people, but the infrastructure, the systems to help people in a crisis that we have created needs to stay maybe in a dormant situation so that next time something like that happens, we can trigger those systems much quicker than last time. Next slide. Then we can use the recovery spending to get all sorts of benefits. So everybody will want to spend public money to create jobs and boost the activity, but we can use those resources to also build the long-term growth, build resilience, and contribute to the green growth and the decarbonization of our energy systems. We at the World Bank have created this sustainability checklist to help governments select the right projects that can deliver short-term benefits and long-term benefits. And that's really something that we want to promote and use as much as we can. Next slide. There is one thing we have been discussing quite a lot, the fact that green projects like solar energy, urban transport, all of that is very good to create jobs. You have to check that your population has the right skills and that your projects are ready to go, but there is a huge potential in creating short-term jobs with green projects that can also help your economy over the long term. Next slide. Today is not the case. Today, if you look at the recovery packages for COVID and the money spent in energy in those packages, about half is in fossil fuels. So a lot is investing in the technologies from yesterday, which means that countries would get out of the COVID crisis with the same problems they had before, instead of trying to use that to leapfrog and get out of COVID in a better place. Next slide. There is a huge potential in spending this recovery money in building resilience. We have estimated that every dollar invested in resilience brings back $4 in avoided losses. So it's a very good investment. And if you move to the next slide, I want to stress one specific opportunity, which is maintenance. A lot of countries have a backlog in maintenance, and that is responsible for a lot of the damages from disasters. If you don't cut your forests, the first storm, you have no power because your transmission lines will be down. In many countries, maintaining roads is much more efficient to improve your service than building new roads. Next slide. So maintenance is a good idea, and it's also very quick to put in place, and it's also very labor intensive. So here you see the job created with $1 million in new assets. And if you go to the next slide, you see the same thing for maintenance. So there is no real competition, right? Maintenance, your projects can go much quicker and you will create much more job with that. So if you have a backlog in maintenance and it creates lack of reliability for your infrastructure, this is a very good place to go spend money. Next slide. So just to conclude, we have applied those ideas in a case study in Fiji. We started from the climate vulnerability assessment in Fiji, which is a set of 125 interventions to build the resilience of the islands. Next slide. And what we did, and this will be my last slide, what we did is out of these 125 interventions, we looked at which ones are good to create a short-term stimulus, but also good for resilience, good for the environment, and good for long-term progress and growth in the country. And we highlighted 10 measures for 3% of GDP that can tick all of those boxes. So lesson here is when we do those recovery packages, there is no reason to look only at the short-term benefits and to leave on the table all of the long-term benefits that we can capture at the same time. We can create packages that deliver over the short term and over the long term, and this is where the highest value lies. So I'll stop here, and I'll thank you very much for the invitation again. and looking forward to the rest of the discussion. Thank you.